So good morning. Today we are discussing about the cocaine and myocardial infarction. So cocaine is basically a stimulant drug that is extracted from the leaves of two species of coca plant, and it has a specific mechanism of action. I will let you know the brief how does it produces symptoms. So before going into the background of that, I will let you know how does it affect what are the mechanism of their actions. Number one is that what it's doing, it prevent the reuptake of serotonin, dopamine, and the norepinephrine in the presynaptic spaces. So as a result of that, their levels is getting increased and they produce the sympathetic activation. So we all know that the sympathetic activation can cause the high blood pressure, tachycardia, euphoric symptoms, and restlessness, chest pain. There could be a short of breath as well. The chest pain especially mimic exactly like of the myocardial infarction. So there are a number of theories that represent that what would be the why the cocaine present like the myocardial infarction pain. So one of that is they causing the coronary artery spasm. And this coronary artery spasm can also lead the platelet activation, which further deteriorate the spasm. So now I already mentioned you about the symptoms of the cocaine produced uh, sympathetic symptoms. Moreover, many patients usually take this like in the form of sniffing them, in the form of IV drug as well, or in any other form. So usually patients who are taking in the intoxication phase present to emergency department with a chest pain, high blood pressure, tachycardia, euphoric symptoms, restlessness, and at that time, our main management would be we just need to rule out whether this is a myocardial infarction or that is the cocaine induced myocardial infarction. So the treatment modalities are number one, we first examine the patient completely. We do the ECG and the troponin I and troponin T. There would be an ECG changes as well associated with the cocaine use. That could be ST elevations. Sorry. And then the troponin INT. But the management would be a little bit different from the MI. In case of the intoxication of the cocaine, we are not supposed to give the beta blockers. Why? The reason is that the beta blocker further deteriorate the condition. It further causes the coronary artery spasm that I already mentioned you about it. When it causes further spasm, so there would be a more chance of the infarction of the heart. So our treatment modality started with the physical examination, with the ECG, and the management would be the IV line maintained. First, we do the IV line. We give the morphine to our patient, then the oxygen, then the nitroglycerine and aspirin. We can introduce the heparin as well after ruling out any contraindications related to the heparin. And if we come across that this patient having exactly cocaine induced infarction, we will need to arrange the PCI as well. So we should not wait for a long time. We are quickly arrange for the PCI nearby facility within the 90 minutes so that we can save our patient. The management, this is the acute management. But for the long-term management, there is a now collaborating role and communicating role here. So internists do their work. Now there is a role of the psychiatrist as well here. These patients need the cognitive behavioral therapy as well. We need to discuss about the risk and the benefits associated with it. So we need to tell that cocaine has this side effect. It can further deteriorate your heart condition. So there must be, if the patient is willing for that, there must be a cognitive behavioral therapy, which really helps. So it is not just a medical treatment, it's a complete teamwork treatment. Only not the internists or cardiologists are involved. Psychiatrists play their role as well. If the patient needs some kind of the help, we can link him or her, we can link the, I would say, the patient to the social services as well, and social support as well, so the patient can go and check with other people who are coping with this condition, so how to cope. So this is basically a small brief background of a cocaine, their symptoms and management, and how we can proceed further. Thank you so much.